According to the CDC, heart disease is the leading cause of death for both men and women, killing nearly 400,000 people annually. For this edition of The Biz, we're here at Henry Ford West Bloomfield Hospital to find out what you can do to maintain a healthy heart and prevent the disease.
So I think the main factor in maintaining a healthy heart is really to have a balanced diet with good nutrition and having regular exercise, because I think those are the main things that sort of establish a healthy lifestyle, and we sort of all of our medical problems can sort of stem from that. And I think activity level and good nutrition are the foundation for a healthy heart.
How does good nutrition help our heart?
Well, everything we put in our body gets processed and can cause different effects on the body. So the good nutrition, mostly in terms of the heart, is based on cholesterol intake and fat intake, because those affect sort of our overall weight status and can affect the cholesterol buildup in our arteries that can later lead to heart attack and stroke. So it's very important to have a healthy, balanced diet of fruits and vegetables and a lot of foods that are low in saturated and trans fats, because those confer the greatest risk in terms of elevating your LDL or bad cholesterol.
Other than weight management and a well-balanced diet, stress also plays a role as a risk factor to heart disease.
Well, definitely there's a mind and body connection, and stress can definitely lead to rhythm problems of the heart. It can cause pain sensations, make you feel short of breath, and have similar symptoms to heart attack, actually. So people can feel a lot of stress and anxiety when they're having sort of what we call panic attacks or high stress moments. And in fact, there's a condition that is actually called a stress-induced cardiomyopathy, that if you see someone that might have lost a spouse or had their house catch on fire or something like that, it can actually lead to heart failure, and that can sometimes be permanent or transient. So definitely stress management is something I try to enforce with my patients, because it does really keep you in tune with that mind-body connection and sort of think about your whole health as one, instead of just trying to target one specific area at a time.
What are the tips you give your patients for preventing stress?
So the main thing is trying to get enough sleep, because a lot of stress we have is based on responsibilities that we have in work or home life. So if you really start with that basic foundation of getting at least 6, preferably 8 hours of sleep, I think your overall perspective on life will change. Take it from someone that's drinking coffee like it's going out of style, but we try to really enforce that good sleep is the first start. And then for different people, it might be different. You know, some people really find that meditation, spiritual prayer can help them sort of focus and calm down. And we have seen effects that, especially in small studies, that yoga can really help control heart rate, which we know is beneficial for heart health.
Worried about your heart? Don't be alarmed. There are ways for you and your physician to check if you are at risk for heart disease.
So there's several options. The first one is to always check in with your primary care physician first, because that's sort of the gateway to all of your health, to make sure all your age-appropriate cancer screenings are up to date and to screen for risk factors. We say to know your numbers. So basically that's your body mass index or your waist circumference. So that's getting what your weight status is. The other thing is your blood pressure, to know what your blood pressure is if you're being treated or undertreated for high blood pressure. Another thing would be to know your cholesterol levels. We have new guidelines now that's sort of trying to work toward more primary prevention and starting cholesterol medications earlier to prevent diseases down the road, rather than have them come on afterwards and then start medications. And then lastly, I think the thing is really knowing what your sugar status is, if you have diabetes or something that we call pre-diabetes, so that we can start to work on these risk factors and modify those as we can.
And Dr. Deirdre Mattina gives us one last tip about heart health.
There's one thing I can impart today. It's that we need to move from a healthcare system that is focusing on sick care and just waiting till you're sick to go to the doctor, or waiting till you have an event to see healthcare and then get started on medications, to a society where we really come in healthy and start to work on our risk factors so that we do not develop those diseases down the road.
Maintaining a healthy heart is no easy task, but heart disease is preventable. For Civic Center TV, I'm Michelle Roberts, and that's your biz.